This episode is sponsored by my Fall Fast Track, the only 6-week distance mastermind course to help you profit from the private market using performance testing. Enrollment starts on August 1st. Find out more at homeperformance.training. Welcome to the Building Performance Podcast from the Building Performance Workshop. I'm Corbett Lunsford, and we're talking about trends in performance-based building and improvements today with Larry Zarker, who is the CEO of the Building Performance Institute, which you may know as BPI. Larry, thanks so much for talking with us today.
Thanks for having me on, Corbett.
So we're recording at the Habitat X think tank, which is in Montana this year. And yesterday, because I'm a testing guy, I just mentioned out loud in the room that I know for a fact that there are people who are certified and there are people who test, and they are not always the same people. And I was surprised to hear that you actually responded positively to that. Do you have anything to add?
Well, actually, what you said was I would prefer someone tests who isn't certified than to have someone certified who doesn't do the testing. And I generally agree with that. I mean, our purpose is to have people who have the knowledge, skills, and abilities to do the proper testing. We expect through their certification that they're going to do it. And if they don't do it, that's really a disservice to the industry. Conversely, on the other side, I would say that a person who has trained themselves to do the testing and does it every time, that's a good thing. I would like to see that they prove their competency so that there is a bar. But certainly testing is important. We know that testing is critical to having valid information.
Cool. Awesome. Well, I was really happy to hear you say that as the head of a credentialing organization. So recently, OSHA released some new safety guidelines. Will you tell us what the big news is on that?
Yeah, the big news is that OSHA has changed their confined spaces regulation as it relates to construction. They've had confined spaces on the books for a number of years relating to tunnels and manholes and making sure that people don't die in them. But now they're going to regulate going into crawl spaces and attics. I estimate that this could affect as many as 1 million contracting companies who do work in homes. And this could be electrical, plumbing, HVAC, home performance companies, insulation companies. And that's pretty big news because there are some requirements behind it that are pretty onerous. For one, you need to have a safety plan in place for your company. And secondly, you need to permit workers who go into that space. So you don't have to go down to City Hall and get a permit. But the company is responsible for having a permit in place and regulating entry and egress from these attics and crawl spaces.
What's a safety plan? Is that like if somebody gets electrocuted, we're going to carry them out on a stretcher?
No, I think it's more important that you understand what materials are going in, what the conditions are going to be like in that space. Is there going to be enough oxygen? Is there a potential trip and fall hazard there? Is a wall going to fall over on the worker when they're in there? And OSHA cites a case of someone using spray-applied polyurethane foam, and it ignited and they died. They also use the example of 2 workers in a crawl space applying primer, and some spark ignited the fumes from the primer, and they both died. And they're using this to extrapolate the number of lives that are potentially saved each year. So the safety plan would basically assess the capability of the person going in and the materials that they take in for the jobs that they're going to perform.
Yeah. Does this potentially mean, I'm thinking as a person who doesn't have employees, if I'm a one-person handyman shop or a one-member plumbing company, and I just go out and do the work myself, am I potentially way, way cheaper now than my competition who has employees, who has to have the safety plan, who has to comply with the rules? Is that going to kind of widen the gap between the guy with the truck and the company that's actually trying to toe the line and has processes in place?
Or is it going to require that you double your staff so you can have someone sitting outside ensuring that you get out safely?
My wife is going to be so upset.
Yeah.
It's Saturday.
Yeah. But you know, we did a webinar last week for the industry. A lot of people in the industry are concerned when OSHA puts out a new regulation. They have a tendency to go out and find contractors who are not meeting the requirement, fine them severely, and hold them up high so that everyone sees in the industry that this is real, and then they all start to conform. So we held a webinar, 5,000 people signed up, and we maxed out at 1,000 people in the first few minutes of signing up. So we think this is a really important issue for the industry, and we want to make sure that the home performance contractors stay out ahead of this and don't get behind on it. Now, we probably had 100 people ask the same question you just asked me. What about me? I'm just doing audits. I'm just a sole proprietor. I don't know. And we need to get some clarification on some of the issues. And I think it's important that if there are certain activities that fall outside of the scope, that we make sure that they fall outside of the scope.
So are you going to hold more webinars, or is it recorded somewhere?
It is recorded.
Great. I'll put a link in the description of this podcast on the page so that people can find it. Yeah,
it's a kind of nuts and bolts webinar. We're going to probably go the route of using an OSHA consultant to work with us and deliver more webinars. Our idea is that we can go to individual companies and then let them alert their entire customer base that this is coming and that it's important that they have people on there, and then do it tailored company by company,
cool.
trade association by trade association, so that they get out ahead of this.
Yeah. Cool. Okay. So another thing that we're talking about here at Habitat X is the health and non-energy benefits, and that's with a capital NEB, right? So the non-energy benefits of performance improvements in homes and in commercial buildings are starting to actually get some numbers behind them. Can you kind of elaborate on what's going on? What's the new stuff that's going on there?
Well, many of us are concerned that the regulatory environment only allows the measures that meet the cost effectiveness tests are allowed in any incentive program
for energy efficiency.
For energy efficiency specifically, and the non-energy benefits never get introduced. And
can you list some of those benefits?
Yeah. So one of the things I talked about today in Habitat X is a study in in New Zealand, that had 188,500 homes, over $350 million in investment trying to quantify energy savings. And the primary savings were related to health. So you had a 23% reduction in days off work for parents, 39% reduction in days off school for children, and 90% of the benefits that they found were actually health related. In another study, the Green and Healthy Homes Initiative in Baltimore did a study of 100 low-income housing units in Baltimore with children with asthma, and they found by weatherizing the home, doing the home performance upgrade, that they were able to reduce emergency room visits for asthma by 67%. Now, Aetna quantified that as worth $880 per emergency room visit, and $8,800 if you stay over in the hospital.
For a slumber party.
Yeah, right. An asthma slumber party. And the problem with asthma, it is a national epidemic. It's growing rapidly. It does affect low-income housing populations more severely. And it is one of those conditions that leads to repeat admissions. So we're thinking that child goes back 2, 3, 4 times, $8,800 times 4 is a pretty large number. You could do some really important work in the home that might actually complement the work that the physician is doing to help manage their health care.
$8,800 as a figure sounds like all of the possible savings over 30 years in a single family home from energy, if we're talking about that kind of a collection, right? That's a huge number when you talk about energy benefits. So when we're talking about quantifying this stuff, are the people who run what has traditionally been known as energy efficiency programs, and the utilities specifically are the ones who kind of are in, legislated to run these programs to get them off the ground. How do they, number one, admit to everybody that there's actually a whole bunch of stuff that's way more important for the world than just the energy benefits? And number two, how do they capture those benefits? Because they're an energy company. That's not really their job.
It's off the table. It's not included. And it's not included because of the structure of the regulatory environment. The regulatory commission who oversees the use of public incentives doesn't allow any measures that are oriented toward non-energy benefits. So only the cost-effective energy efficiency measures are the ones that get allowed.
Even still, even though we know for a fact now, because we've got data that shows that there's way more savings that we're actually delivering.
Well, I think, our perspective is home performance. So one aspect of home performance is energy savings. The other aspect of home performance that many contractors talk about is comfort. Well, how do you quantify comfort? How do you quantify rooms you can't bring to temperature in the summer or winter? Or how do you quantify drafts in the home, that cause you irritation? How do you quantify asthma? Well, we're starting to get some metrics that are pretty important. The Green and Healthy Homes Initiative has independent third-party evaluation of the work they do because they need to be able to quantify what they're actually achieving. So as we get this body of knowledge, our work as home performance professionals becomes the total that it was always meant to be.
So the homeowner is the one that I'm specifically thinking of right now. If they hire a home performance professional to help them make upgrades so they can control their home's temperatures and it, blah, 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 et cetera, they, as a side effect of that, capture energy efficiency benefits, and they also get health benefits out of it. Is that person going to be rewarded for any of that, aside from the fact that their life got better? I know this sounds really ridiculous to ask this way, but the way that the energy efficiency program works is the energy company will pay you, homeowner, to make your home better because you have reduced your load on society, right? Mm-hmm. So are the health insurance companies or the hospitals, or is anyone willing to compensate a homeowner for spending thousands of dollars to make their home better in the fact that they're now reducing their burden on society?
I don't think they're asking the right questions. The contractors aren't asking the right questions because they're being driven by these single measure incentives. And what we need to be able to do is to go in and ask the right questions about how people are living in their homes. What kinds of problems do they have? Do they have kids who have asthma or chronic sinusitis or something like that? And what we've found is that if you approach, and this we see in the blogs and the literature, consumers glaze over about energy savings. They just, they don't care that you're going to get 2 or 3 pizzas worth of savings every week or every month. But if you say we can get your daughter back out on the soccer field and she's going to be able to rejoin the team because we fixed that sinusitis problem that she gets every fall, parents will pay any amount of money to get that fixed, and they get the side benefit of the energy efficiency savings. So I like to think of it as the other way around. We've been pushing the wrong driver. We need to push the driver that consumers care about, which is comfort, health, and safety in the home.
Mm-hmm. This is an interesting conundrum, though, because when you and I are talking right here across the table from each other, we're having this personal interaction. And if I promise you that if I give you this piece of paper, that you can turn this into the bank for $10 million, and that actually doesn't happen, then you'll be upset with me. So if I say I'm going to cure your sickness, and it might not happen because it's now at this point where we're dealing with big data and statistics. So that 188,500 homes that you're talking about in New Zealand was like a body of like a huge sample set, basically, right? And they captured all of those savings out of the group. But some people probably in that group either didn't have a response health-wise, or maybe even got sicker after their home got fixed for no apparent reason at all. So how do we, without like a wide-scale attention paid to it by health industry in general, how do we kind of start to capture any of this or make it mean anything for the construction industry?
We are in the indoor air quality business in one respect or another, and we are making recommendations. What we found in the large meta-studies, meaning studies of the big studies, so looking at across 500 studies in general, if you do multiple interventions like we do in home performance, then what kind of impact are you going to have? Across the population, you can expect that you're going to have improvements in the health outcomes. You can't say that I'm going to cure this child of this condition. It's just not possible. But to have physicians who say, I've been on courses of medicine, other courses of medicine, I can't have an impact. Let's go back and look at conditions in the home. You know that there are certain kinds of factors that are going to influence the health of people living in that home. If there's mold and excessive moisture, you can expect that in a certain number of individuals, you can't say which ones, they may have a negative reaction to that. So some may improve, some may not. We can't say that we're going to go in and cure someone of asthma. But I think across the population, if you're doing the right thing, then in general, you're going to see net positive outcomes.
So is there something specific, or I guess what's on the horizon for the performance-based construction professionals to get doctors to prescribe home performance upgrades as part of kind of a medical holistic thing while they're also looking at diet and things like that? Is there any mechanism that's on the horizon that you can see where that would actually happen?
So I was at the National Healthy Homes Conference last year in Nashville, and Kevin Kennedy from the Children's Mercy Hospital in Kansas City, along with the department director for respiratory medicine at the hospital, Jay Portnoy, spoke. And Jay said, I have been working now on protocols for intervention for 10 years, and I've turned my attention to the insurance industry to be able to get the checkbox on the form that allows me to get reimbursed when I check that box. And he said, you can't believe how difficult it is to go upstream into the insurance industry. But once you get the box there, then it gets repeated for other doctors, and they know when to check that and have that work done. So I think we're making progress, but we need to have better collaboration with the medical community, with the insurance community, the home performance community, and if the programs who provide incentives can align with that, then we could see some real positive outcome.
Is that something that BPI is working to help to manifest?
Yeah, as a matter of fact, we met with EPA a couple of weeks ago, and EPA said, how can we help with something like this? And one of the ways that they can help, and they have offered to help, is to go to the state Medicaid boards who are looking at what kinds of credentials could be valid for when you send someone into the home to do the assessment. And the micro-credential that we're working on with this extended community could be one of those. And so we're working with HUD, working with EPA and DOE to try and take this to a larger level, to the Medicaid community, ultimately to the insurance industry in general.
Awesome. Thank you very much for talking about this, Larry.
Okay, thank you.
Larry Zarker is the CEO of the Building Performance Institute. You have been listening to the Building Performance Podcast. I'm Corbett Lunsford. Tune in next time. Hey, podcast listeners, it's Corbett. Thanks so much for sticking around at the end. I have been hearing from some of you because of these messages that I've been leaving at the end of the podcast, which I am delighted about. I love hearing from people who listen. So a couple things real quick. If you like what is on this show and you would like to learn more about what I have learned from the people that I've been asking questions of and the houses that I've been in, there are a couple of opportunities to do that. One that is totally free and takes only a half an hour of time every month is my Building Building Forensics Mastermind series. This is a monthly webinar series that's essentially a reality show for watching building forensics happen in real life and hearing about how I use advanced testing. That is the precursor to our television show, which you're going to see on network television next year to get normal Americans to understand this stuff. That's going to be called Home Diagnosis. Secondly, I have my mastermind course, which is starting very soon. It starts on Labor Day weekend of every year. It's called Fall Fast Track. If you are serious about becoming somebody who really is able to use performance metrics to prove that you do better work than your competition, or if you would like to be able to prove that you're getting what you pay for from the people that you hire, either one of those things you can learn and become an expert at in the Fall Fast Track. This is where the ninjas and the black belts get made in this industry. Lastly, I will be touring the country with my wife in a tiny lab and teaching everybody that we meet about home performance and performance-based building. That is called the Proof is Possible Tour, and you can find out more about that at proofispossible.com. All the rest of that stuff is available on my main website, which is buildingperformanceworkshop.com. Thanks so much for listening. I hope that you tune in next time.